Thank you so much. I want you to imagine a world where every brilliant idea, be it in medicine, education, technology, or public health, doesn't just stay in the journal or in the lab, but can actually use to transform lives. Yes, it is possible. It seems little difficult, but yes, it's possible. I want you to imagine a situation where a health worker has to walk 10 kilometers every single day just to deliver DOTS medicine in small tribal villages in Jharkhand. The health worker, they're doing their task. They're delivering the medicine every single day. But what about tuberculosis cases? Are they reducing? This is where implementation research comes in. Not to invent any new cure, but to find out why the existing strategies that we already have in place is not working. What are the major challenges? And how can we make it possible? Hello everyone, I'm Piyusha Majumdar, and today I'm going to talk about how implementation research is transforming the public health program and how implementation research has helped me in transforming my life too. Talking about the definition of implementation research in a layman's language. In the simplest language, implementation research is nothing but putting your house in order, making the best use of what you already have. It's a combination of efficiency and effectiveness, using the best resources that you already have, and using the strategies or modifying the strategies which is contextually relevant and evidence-based. So implementation research basically studies the barrier and the facilitator that is important, that is actually affecting the implementation of a public health program. It also finds out the unintended consequences that has come up during the implementation of the program. While we implement any public health program, we never thought about the unintended consequences. But in implementation research, it's very important to find out what intended it cause, whether it's positive or it's negative. So we must come up with a strategy that is used to address those barriers that has come up during the implementation of the program. Now let me give you the example of polio health program and find out how it is important in implementation research. Everyone thought that we would be able to eliminate polio by 2000. It was not that difficult task. We already had our vaccine in place. We already had our people in place. We already have our human resource available. We already have our logistics available. So what happened? Why it took us 30 years to eliminate polio from our country? And the answer lies in one of the key concepts of implementation research, that is the context. While we were implementing the polio program, we have never realized that how important context is and how the context is different from one state to another. The context that has happened in southern states, it is very much different in the eastern state. So the strategy that worked well in southern state, it didn't work well in the eastern state. And that is why Uttar Pradesh and Bihar were the last state to eliminate the disease from their state. They were the last ones to have 0 cases. So now, implementation research, so what we find out from this lessons, the lesson that is learned from the polio eradication program, that we must contextualize. The strategies must be contextualized. Strategies must be localized as per the need of the place. The second example that I want to give you here is the malaria eradication. Now, we all know that it is the oldest disease of civilization. We have been working hard to eliminate this disease of this disease. But have we been able to do that? No. Despite of our best efforts, despite of our sustained efforts, we have not been able to do so. But there is one country that has eliminated and become malaria-free recently. Do you know the name of the country? It's Timor-Leste. Yes, my dear friend, Timor-Leste, the country that was endemic at one point of time, has now become malaria-free, and they have recently received the certification from World Health Organization as well. So what this country did additional? So this country has also applied the key principle of implementation research. They have used the robust strategy, whether it's community mobilization or the strict surveillance or taking care of their healthcare system. So they have implemented the robust strategy. They have used the right people. They have taken care of their vulnerable population, and by using all these things, they have been able to eliminate the malaria and achieve the malaria-free status. So now, as we are talking about implementation research, so what are the main three key principles of implementation research? The first one is context matter. The second, stakeholder engagement. And the third, and which is unavoidable, is knowledge translation. So now the strategy, if we talk about context, the strategy, the solution, the program that worked well in one country, in a province, in a state, in a district, in a place, it might not work in another because of the contextual differences. And these contexts could be the cultural differences that are happening. These contexts can be the social, legal, or any other challenges. So if one wants to implement the strategy at the real field, one must study the context well before implementing it if we wanted to succeed in our program. The second important thing is the stakeholders. The stakeholders could be anyone who are either influenced by the program, who could either be affected by the program, or one who are involved in the program. So all those people, whether it's patient or healthcare provider or our policy maker or our program implementer, it's necessary that we include all those major people in our program. Right from the beginning or the designing of the program, while in the implementation, and also during the delivery, we have to ensure that the right people should be involved. They should be collaborated if we want to be successful and if we wanted to reach to a particular outcome. The third most important thing here is the knowledge translation, which we often forget. Every day, every single day, we know that every single day some research is going on. But do you know, there is a research that shows that it took us 17 long years to turn our discoveries, to turn our findings into action. And the main reason, due to the delay in knowledge translation. So implementation research ensure that the strategy that we make, it do not get lost due to the delay in knowledge translation. So whatever finding comes from the research, we must translate it and disseminate it to the audience, to the people who actually need, whether it's policy maker or a general community member, it should be reached to those people. While I was doing our project with Johns Hopkins University, we were taught that it's not only the knowledge translation, but also knowledge brokerage, also knowledge diffusion, and knowledge integration is important. So the knowledge that has been gained, it must be integrated into a health system. So these are the three principles that I'm talking about from the implementation research. Now, whatever I'm talking here, this isn't a theory. I have lived through this experience. I started my journey as a young researcher with a lot of big dreams. When I got associated with our project STRIVE, that is Synthesis and Translation of Research and Innovation in Polio Eradication, in collaboration with Johns Hopkins University and 7 other country partners across Africa and Asian region, we got to learn that there are so many things that we can learn from the lessons. A lot of lessons can be learned from the polio eradication program. There are a lot of things that we can learn, whether it is about context or it is about stakeholder engagement or the knowledge translation. We can learn a lot because every time they have revised their strategy, every time the strategy was evolved. And that is how we have been able to eliminate polio from our country. For any public, in any public health, the greatest triumph is elimination of disease, and we have been able to do so because of the implementation research. So while I was doing our project with Johns Hopkins University, we have been asked to develop some learning material on the core competency of implementation research. So we did that, and I'm happy to share that these materials have been used by the public health professional. I also got associated with the project of TDR, WHO TDR Postgraduate Training Scheme, in which we are providing residential training to the students from conflict-hit country. Now, it was not an easy task to bring all those students to India. First reason, because it's conflict-hit country and the visa formality, it was never easy. But we are training those students. And by looking them after receiving the training here, when the students go back and apply their implementation research skills to strengthen their fragmented healthcare system, it is elated to see that. And my heart swells with pride when I see our students working and they become a real change maker. So we are nurturing the real change makers who are actually transforming the health system where we could not go or where we had almost given up. Recently, we have also organized a workshop, a multi-country workshop. So I learned designing the workshop by collaborating with many international research experts across the country. We have designed a workshop for them, and we together collaborated, co-created a lot of strategies, solutions, teaching cases, learning material, which have been used by the global public health fraternity. This summer, when I got invitation from TDR to present our work, while I was standing there or giving my speech on implementation research, I was thinking about this little Piyusha, the little girl of a 9-year-old who has always dreamed of doing something bigger in the life, and that dream has turned into the reality through implementation research. So in the end, I would like to conclude that if the medicine in public health is the seed, then implementation research is the soil in which it is planted on. So it's very important that the implementers, policy makers, our public health practitioner, they must know about it, what implementation research is, if we want to achieve our sustainable development goals on time. Thank you so much.